Doctor, my recent health check showed high blood sugar levels. I'm worried I might develop diabetes. I'm trying to watch my diet, but what could be the cause?
Recent research has shed new light on the causes of diabetes and obesity. Previously, it was thought that fat and carbohydrate intake were the main causes, but it's not that simple. And if you enjoyed this video, please subscribe to the channel and click the like button. I'd also love to hear your thoughts in the comments. Now, back to our discussion.
By the way, doctor, which is more effective, a low-fat diet or a low-carb diet?
Both diets have their merits and are not mutually exclusive. The issue with Western diets is the high content of fats and carbohydrates in processed foods. It's possible to integrate both diet approaches.
Integrate them? How so?
It means reducing excessive fat and carbohydrate intake simultaneously. Paying particular attention to fructose intake and avoiding processed foods and sugary drinks can help prevent diabetes and obesity.
What impact does high fructose food have?
Fructose, commonly found in processed foods and sugary drinks, is high in calories and low in nutrients. Overconsumption can lead to obesity, type 2 diabetes, and fatty liver disease. Diets high in fructose are linked to a higher incidence of metabolic diseases.
So, I should avoid high fructose foods and drinks. What foods are high in fructose?
Be particularly mindful of sugary snacks and beverages. Do you consume a lot of sweet snacks and drinks?
Yes, I love sweet snacks and drinks. Do they really have that much impact?
Yes, they do. Conditions like non-alcoholic fatty liver disease, NAFLD, are not only linked to excessive alcohol consumption but also to diabetes and obesity. Reducing intake of high fructose processed foods and sugary drinks can help reduce these risks. Fructose metabolism can decrease ATP, the body's energy currency, leading to overeating and increased hunger.
I understand that overconsumption of fructose is bad. Are the sugars in sweet snacks and drinks worse for health than those in rice or bread?
Carbohydrates include complex carbs found in rice, bread, grains, potatoes, and vegetables, as well as simple sugars like fructose and glucose. Complex carbs are absorbed slowly and contain fiber and nutrients, whereas simple sugars found in processed foods and drinks are absorbed quickly, are high in calories, and have low nutritional value. Excessive simple sugar intake increases the risk of obesity and diabetes.
So, foods high in simple sugars are not good for me.
Exactly. Many processed foods and sugary drinks contain high fructose corn syrup and glucose fructose syrup, which are types of simple sugars. These are made from cornstarch, are very sweet and inexpensive, hence widely used.
I see. It's important to reduce processed foods, sweet snacks, and drinks.
Yes, be mindful of overconsumption.
Thank you. I'll try to avoid simple sugars and not overconsume fats and carbohydrates.
It's also important to understand how your body processes these nutrients, especially the impact on insulin-producing cells.
What are insulin-producing cells?
Insulin-producing cells, located in the pancreas, are crucial for regulating blood sugar levels by producing the hormone insulin. Understanding how these cells are affected is key to understanding diabetes and obesity.
How do high-calorie diets affect insulin-producing cells?
Studies have shown that high-fat, high-sugar diets can lead to excessive fructose intake, which damages the pancreatic beta cells that produce insulin. This increases the risk of type 2 diabetes, heart disease, and stroke. Insufficient insulin or dysfunctional insulin production leads to high blood sugar levels, eventually exhausting the pancreas's ability to produce insulin.
High-fat, high-sugar diets are really harmful, then.
Yes, animal studies have shown that such diets increase fructose metabolism in the small intestine, leading to a decrease in pancreatic beta cells, which reduces blood insulin levels and increases blood sugar. This direct impact on insulin-producing cells, not just insulin resistance, raises the risk of type 2 diabetes.
Thank you. It's a bit complex, but I understand better now. Can you summarize today's video?
Certainly. Excessive fructose intake is linked to diabetes and obesity. Fructose is found in sugary snacks, drinks, and processed foods. Metabolic byproducts of fructose damage the pancreatic beta cells, leading to insufficient insulin production and high blood sugar levels, which increase the risks of type 2 diabetes, heart disease, and stroke. High-fat, high-sugar diets also impact fructose metabolism, thus not being healthy choices.
Thank you.
If you enjoyed this video, please subscribe to the channel and click the like button. I'd love to hear your thoughts in the comments.